Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. We're honored to be here on the territory of the Lekwungen-speaking people, the Songhees, and the Esquimalt First Nations. We'll be doing a briefing tomorrow at 3 o'clock here in the Press Theatre in Victoria, and on Friday we'll be providing a written briefing with relevant information on COVID-19 in British Columbia. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much and good afternoon. So for today, December 2nd, we have 834 new cases to report of COVID-19 in the province, 3 of whom are epidemiologically linked cases, bringing our total number of cases in British Columbia to 34,728 people. That includes 174 people in the Vancouver Coastal Health Region, 529 people in Fraser Health Region today, 20 people on Vancouver Island Health, 66 people in the Interior Health Region, and 45 people in Northern Health. We now have 8,941 active cases across the province, of whom 337 are in hospital, 79 of whom are in critical care or ICU. We have 12 new deaths to report today, bringing the total number of people who've died from COVID-19 in BC to 469. And my heartfelt condolences go out to the families who have lost loved ones again today, and to their care providers, and to their communities. We mourn with you. We have 10,201 people under active public health monitoring around the province, and 24,424 people who have recovered from COVID-19. There are 3 new healthcare facility outbreaks at Royal City Manor in Fraser Health Region, at the Saanich Peninsula Hospital in Vancouver Island, and the West Coast General Hospital in Port Alberni on Vancouver Island. In addition, we have 3 long-term care outbreaks that have been declared over at Cottage Worthington Pavilion, Discovery Harbour Centre and Orchard Manor, and at 2 acute care units where outbreaks have resolved at the Burnaby Hospital 3C and Langley Memorial Hospital 4SC. That leaves us with 54 active outbreaks in long-term care and assisted living, and 7 in acute care, in that both hospitals have other units that are still active. Our active cases in long-term care are 1,472, 926 residents, and 536 staff. In addition, there have been 2 new community outbreaks at the Cove Shelter in Fraser Health, and also Millennium Pacific greenhouses, where we have a number of workers who've been affected by COVID-19 in both of those areas, and Fraser Health is leading the response and the outbreak response in both of those communities. Today, you may have heard the United Kingdom has approved the first vaccine outside of China and Russia, the Pfizer vaccine, the COVID vaccine for use in people, and I know that other nations, including Canada, will be following, hopefully sooner rather than later. And this is, of course, very exciting news for all of us. This is part of the solution to what we are going through, but it is going to be some time yet before we get there. It is, however, clear evidence that we do have light ahead. And in BC, we are working very hard to put together our immunization strategy for everybody across the province who wants to be immunized. And we are ready to provide it. We will be ready to provide it to the high priority populations as soon as vaccine is available for us here in BC. And we're working, as you know, with Dr. Ross Brown, myself and our team at BC CDC and across the health authorities to make sure that we are ready as soon as vaccine is approved for use in this country. So that is exciting news for all of us. I recognize as well that this virus, COVID-19, is taking a toll on all of us, and this pandemic has been relentless for the last 10 months. And after many months of restrictions on who we can see and where we can go and what we can do, we are all feeling that fatigue. I know many, many people are doing all they can to make sure that we can help each other to get through this COVID response. Yet, I'm asking you all to continue and to do a little bit more, to do our part to slow the spread in our communities, in our families, in our loved ones, in our workplaces, until vaccines are available for all of us. Most importantly, to protect those who are most at risk, particularly our seniors and elders. And we hope and expect that vaccines will be ready in the next few weeks. But this virus continues to move and move quickly between us, and it takes lives. Another 12 families have been affected today. And we are continuing to see unchecked transmission in many places despite our efforts of public health teams, our contact tracing, and all of us to do our part. That is why during this second surge, the need to follow provincial health orders is so important. Those are there because we know that these are situations where this virus can spread very easily now. It's not about bad people and people doing the wrong things. It's the fact that we know this virus can spread even in places where we thought it was safe with the guidelines we had in place just a few months ago. As well, we need more than ever to stay local, to stay small, and avoid public settings right now where we mix with others. They are a risk for all of us. We strongly recommend and have for some time, but I'm asking everybody in BC to consider the importance of not traveling right now unless it is essential for work or for medical care. This includes within BC and between provinces. It has been a challenge for us. We know that there is many people who want to travel, who are coming here from other provinces for recreation and sport. And we know that there are sports teams in BC that have traveled to other provinces despite the restrictions that we've put in place. And we know, for example, there's a hockey team in the interior that traveled to Alberta and has come back, and now there are dozens of people who are infected, and it has spread in the community. We need to stop right now to protect our communities and our families and our healthcare workers. This is avoidable, and these are the measures that we need to take. Making us an exception for yourself or for your team or for your recreational needs puts a crack in our wall, and we see that this virus can exploit that very easily this time of year. I do say, though, if you have a family member who's returning home for the holidays, then that is important and that is fine. But it is critical that when they come here, they need to follow all of our orders and guidelines we have in place here. And that means no socializing, no going outside the home and having parties and gatherings of any kind right now. I cannot stop you by an order and getting into your car or going onto a plane. But I'm asking in the strongest of terms for us to stay put, to stay in our communities and to protect our communities. We continue to see the impact of this virus on our communities, but on our healthcare system and in particular on our seniors and elders in long-term care. And we all need to take a step back to stop that. The detailed, written, amended events and gatherings order is going to be posted after this session here today. And it includes the details on the orders around sport that I presented orally a few weeks ago. So just to remind people, it means that all events are prohibited until next Monday, December 7th, and we are actively looking at what we need to do in our communities to make sure that we are doing the best we can to stop transmission. So right now, events including drive-in and drive-through events, seasonal light displays, all of those important things that we would love to do right now are on pause. Exceptions, of course, are support group meetings, meals and food provided without charge to people in need, and as we've talked about, weddings funerals where the limit is of 10 people. In addition, the additional orders that we talked about on November 19th will be out in detail, and some of the sport details will be there as well. We've spoken about the importance of, I've spoken continuously about how important it is for us to get outside, to move, to be able to have that physical release, and I encourage everybody to go outside every day. Even for 10 minutes, go for a walk, go with your family, stick to your bubble. I will remind everybody, though, that no matter where these activities are taking place, particularly sports, there's to be no travel and no spectators. We have seen that if we maintain our distance and we're respectful to each other, we can be outside, we can go to parks, we can play games, we can make sure that we can do it safely, and we need to continue to do that. However, we do know that indoor group activities, whether it's team activities or group fitness activities, are much higher risk right now. And it's not because people are bad actors or not following guidance. The guidance that we have had in place worked for the time that we were in, but is not sufficient now. And as I've mentioned, I have a team who are looking at this and have been developing advanced guidelines based on what we have found here in BC, in Canada, and from the literature around the world. And it's apparent that it is more complex than we initially thought, but these guidance will be ready next week. And the order identifies the challenges that are the restrictions that are in place until then. In particular, we know that high-intensity fitness activity, indoor group high-intensity fitness activity, is prohibited indefinitely for now, and that includes hot yoga, the spin, some of the high-intensity interval training, and others. The lower-intensity fitness, group fitness activities are on pause until the guidelines are available next week. In addition, we are putting additional restrictions on adult team sports indoors, as we are recognizing that these are indeed higher risk activities as well. What we will be focusing on is structured programs or sport for children and youth, recognizing how important those are for our young people. And we're working with Via Sport to bring those back to the level 2 Via Sport restart guidance that we have had in past. So those details will be posted later today on the PHO website. I know these restrictions put an added burden on what is an already difficult time for all of us, and it seems never ending as we're moving into December. But they are what is required right now. Despite our fatigue, we know that we can make it through this. We know that this is a road that we can travel together if we are strong and united by staying apart. We've done a lot, and you in BC have risen to this challenge. And I'm asking everybody to do a little bit more right now to protect those we are closest to protect our seniors and our elders, and to help see us through to the light that is ahead. It is our collective effort that will make the difference for all of us. And we will get through this. And we will do it as we have been, by remembering to be kind and to stay calm and to stay safe. Thank you.
Thank you very much, Dr. Henry, and I wanted to start by expressing my condolences, that of the Premier of the government, I think of the province, to the families, the friends, the caregivers of the 12 people who passed away from COVID-19 in the last 24 hours. I think we say in BC, and I think that Dr. Henry and everyone on our team tries to convey this every day. I know how we feel about it. We talk about it privately as well, that every person matters, that every case matters, that everyone with a positive test matters, and of course, the loss people who've lost loved ones to COVID-19 matters more than all of that. It is profound and it is difficult, and I want you to know we see you, we hear you, we are with you in these difficult times, and they remind us, I think, of all of the people working in long-term care and acute care, and Dr. Henry talked about the 54 outbreaks in long-term care and the 7 in acute care. We understand the bravery and the generosity of people who work in the sector, the profound challenges for people who have family members in those circumstances. And so when, as Dr. Henry did today, we announced 3 new outbreaks, 2 in acute care and 1 in long-term care, and 5 outbreaks over, we hear the powerful sigh of relief from those who are in the latter category who've had outbreaks declared over, and the anxiety that everyone involved in outbreaks feels. This week has been Monday and Tuesday and Wednesday, an extraordinarily difficult week for everyone involved in this, and it should remind all of us, I think, of what we have to do together right here and right now in this period before the prospects of a vaccine come, to help protect one another and protect our communities from COVID-19. We know we have problems with travel, and Dr. Henry has talked in the transmission of COVID-19, and Dr. Henry talked about that in her presentation. And I just wanted to say some of the same thing to people in other parts of Canada, to people in the province of Quebec, other parts of Francophone Canada. I wanted to say a very similar message in French to them today. Que nous savons que nous avons des problèmes liés au voyage et à la transmission de COVID-19. Les personnes qui se déplacent, que ce soit à travers, à destination ou en provenance de la province, ramènent le virus avec eux. Ce sont des choses que nous devons absolument éviter. Il est essentiel de rester ferme dans notre engagement à protéger notre province. Nous ne pouvons tolérer des lacunes qui pourraient faire reculer tous nos efforts jusqu'à présent. Pour l'heure, tous les déplacements non essentiels sont fortement découragés. Cela comprend les déplacements vers d'autres provinces ou territoires au Canada. Nous demandons aux personnes qui vivent en dehors de la Colombie-Britannique de ne pas visiter notre province, sauf pour des raisons essentielles. Il est donc fortement déconseillé d'entrer ou de sortir de la province pour les loisirs. Je vous prie de considérer soigneusement l'impact important qu'un pas dans la mauvaise direction pourrait avoir sur nous tous. I'd also like to just bring you up to date on the contact tracing recruitment initiative, which we do on Thursdays. This week alone, we've added 161 positions. To date, 1,096 individuals have been hired, more than the 500 initially announced in August and the 608 announced in September. We intend to bring this total to over 1,200 positions. I reported last week that we've added some support from Statistics Canada, 70 people, and that the BC CDC is actively working with the Red Cross, and anticipate that they will bring volunteers and staff to support logistics and running the operational center for the PHSA BC CDC's regional contact tracing hub at the Vancouver Convention Center. The First Nations Health Authority has been approved to hire 76 community health representative positions to support culturally safe contact tracing. There are also 382 candidates at the interview stage for further positions and 113 in the offer process. We would like to thank everybody who stepped up and everyone involved in this initiative, which truly is extraordinary. And finally, I'd just like to note, to talk about seniors care, that under our plan to increase our resources in seniors care, 1,000 people have been hired. But we want to be very clear about one thing. When you have 54 outbreaks in long-term care, that affects workers too. And that puts challenges on long-term care communities. And so we are continuing in every way to seek the resources necessary to support long-term care, those care homes that are currently in outbreak and those that are not. and we will continue to do so. I just want to say in conclusion that I think this is a moment, just one more thing before I say that I will have something to say tomorrow with respect to the recommendations presented to me by the Deputy Minister, Stephen Brown, with respect to PHSA expenses, which some of you may want to ask about today. Finally, I just want to say that this is really the time to dig in for all of us. The orders that Dr. Henry put in place now a couple of weeks ago, those orders, I think, have been overwhelmingly respected. But again, we cannot and we must not attempt to litigate, to try and push to the far edges of those orders. We need to come together now and follow them and work with them and work within each other and protect one each other, which means no gatherings outside of your immediate household at home. It means no gatherings, basically, period, outside of the homes, because these are places where we see the transmission of COVID-19. And right now, here and now, in November, or should I say in December, is when the virus is transmitting itself and is the most dangerous. What was possible in August is not possible now. And no amount of arguing or litigating will change that. I so appreciate and admire people in British Columbia and faith communities and the community as a whole who have done extraordinary things during this COVID-19 pandemic. This has been an unbelievable and difficult year. And I think people in British Columbia, our healthcare workers, our essential workers, our communities, people in education, people everywhere have done extraordinary things. I think of the people who staff our grocery stores. And for all of them, for all of those that you love, for all of those that you don't know, now is the time. Now is the time to dig in, to follow the instructions, the orders, the guidance that have been put in place. And if we do that together, we can get through this extraordinary period, not without losses, but with less losses than we would have otherwise. And that, I think, is a profound goal of all of us. The losses in the last week have been considerable. I want you to know they affect everybody involved in this. But we have to, right now, find the energy and the support and the love to do what is necessary to support one another in difficult times. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press *1 to enter the queue. You're limited to one question and one follow-up. Please also take your phones off mute. You are not audible until your name is called. First question today is from Tess Van Straten, Check News.
Hi, Minister Dr. Henry. Given that we're still seeing unchecked transmissions and high numbers, is it likely you'll need to extend the event ban past December 7th?
You know, that is something, of course, that we're looking at. I think we can all see what's happening with transmission. It is challenges that I have put to my team. These are not decisions we make lightly or I make alone, and we are looking at our options. But we will be waiting out the period until Monday to make decisions about what we need to do.
Do you have a follow-up, Tess?
Yes, I do. Thanks. And given travel is still such a big issue and people are coming to Vancouver Island and the Gulf Islands, lots of out-of-province license plates, is it time to be doing essential travel checks at BC ferries, to be asking people before they board the ferry to try to reduce those numbers?
You know, these are the most challenging things, and we've not had to do that before. There are many reasons that people need to travel, and we know that there are many essential reasons that people are coming and going, and it is not. It is a very much a challenge for workers at BC Ferries to take on that role, and I don't believe it's their responsibility to. I think it is all of our responsibility to each other to check about whether what we're doing is for our own needs and recreation, or whether we can postpone this travel until another time where it's safer.
Next question is from David Molko, CTV.
Afternoon. This question primarily for the minister from my colleague Shannon Patterson, and this is around the idea of making vaccines mandatory or maybe a requirement for certain settings or jobs. So once a vaccine is available, should people who work maybe in healthcare and long-term care be compelled whether legally or otherwise, to get vaccinated as a condition of employment, or what's your vision for how this might work?
So I will actually take that on because that is something that is part of my area of focus for many, many years. So we have no mandatory immunization programs in this country and in this province, and we do not expect that COVID immunization will be mandatory either. Having said that, there are some key positions where we know the risk of transmission in long-term care, for example, in some healthcare settings, can be very high. So we will be strongly encouraging everybody in those settings to be immunized. And if people are thinking of going into those settings and don't believe in immunization, then they should look for other things to do. But these vaccines are going to be, I have full confidence that these are going to be effective and safe vaccines when they are ready and approved for use here in Canada. And I know that we are waiting for these, particularly in those areas where people are most vulnerable, and we can protect people very rapidly using these new vaccines that will be available very soon, hopefully.
David, do you have a follow-up? Oh,
I
sorry.
do, Dr. Henry.
No, sorry, just
We had this discussion, I think, 1 year and 7 or 8 months ago about this question around measles immunization. And what has proven effective is engaging with people, and that's what we're going to do in this case as well. I think it's nice to talk about a situation of broad immunization, and we're looking forward to that. Initially, we're going to get the vaccine that we get and make the decisions based on public health advice required to deliver that vaccine. But we'll be providing lots of information for people and support for people because, and the way to do that is to engage, is to educate, and to involve people in those important decisions. And we're not just doing that because we believe that's a good thing to do, or the morally right thing to do, but it's because it's the effective thing to do. And Dr. Henry, who's worked her life on this, will tell you that. People in public health will tell you that, and that's why we're going to continue to do that. So I don't think you'll see those kind of rules put into place. What you will see is for vaccines that I believe will be proven safe, you will see an effort to engage with people and to give people the information they need so that they can feel safe when they get immunized.
David, do you have a follow-up?
I do. Dr. Henry, a Vancouver pop choir has gone virtual. They've done a creative and catchy rendition of All I Want for Christmas Is You. They've turned it into I Will Social Distance With You. So one of the lyrics, I want to hear your lovely tone, but only over Zoom or phone. You know what's coming. This is for the minister, too. I'm not going to ask you to sing, but I do want to know this. In the spirit of the serious message of what the members of this choir are trying to convey, Dr. Bonnie Henry, what do you want for Christmas?
Oh, vaccine? I want this to be over. You know what? I've heard that, and thank you for not asking me to sing because it would be horrific. It's not one of my skills. But I think it's a fabulous choir, and I have seen so many wonderful words of support and people engaging in this, and we need to have that joy and that humor and that in our life through this hard time. And so what I want for Christmas is everybody to stay home with their family and stay safe so that we can get through to the next year.
Next question is from Richard Zisman, Global News.
I'm not sure if this is for Dr. Henry or Minister Dix, but has the province asked the Red Cross for potential field hospitals here in British Columbia?
The field hospitals, no. We have hospitals in a box that we can use. We have mobile medical units, and we have a plan for deployment of hospitals, as you know, at the Convention Center, for example, and others. What we're looking to the Red Cross is relationships that we've had with them for many other types of disasters, where they have logistics support that can help us in terms of how do we set up things, how do we manage things. They've been partners with us in emergency social services for a long time, and so those are the types of skill sets that will enable us to focus on the key medical and clinical things that we need to do, whether it's public health or in some of the response centers and things like that. So we are looking absolutely for support with Red Cross and other community organizations. And in terms of our vaccine planning, we've been talking with Red Cross, with Department of National Defense as well. So we're looking for all of the support that we can get to make sure that we can do these key functions effectively and efficiently.
And just to say that the BCCDC is actively working with the Red Cross and anticipate them supporting by volunteers and staff. The Operations Center for the Contact Tracing Hub at the Vancouver Convention Center reported that, amongst many other things. I know many numbers in the report on contact tracing, but there are, as you know, at the Vancouver Convention Center, there is a hospital that we could use there if required. At present, our issue in critical care, for example, is difficult in some particular areas where there's slightly less critical care and a need to, from time to time, to move people, and you will have heard about that in recent days. But in general, our overall critical care capacity in terms of beds is fine right now. We're in the 50 to 55% range of occupancy if you count base beds and surge beds, and equally we're in the low 70% in occupancy overall in acute care. So it's not the beds at the field hospital that would be required, but we always are looking to increase our staff capacity, particularly in the time of pandemic everywhere, and the logistical support that the Red Cross can provide in this case, and as Dr. Henry has said. So we'll be looking at that, but not in particular looking for a field hospital. The one at the Convention Center is been organized by Vancouver Coastal Health.
Do you have a follow-up, Richard?
Just quickly on clarification, is that human resources, Dr. Henry, that we're working with the Red Cross on?
Yes, yeah. So people who do logistics support, so help organize things and get things to the right place at the right time, and support our systems for moving things through. So Red Cross has a lot of experience around that.
Rob Brown, Dawson Creek Mirror.
Good afternoon. The provincial, conditions that were initially just for Fraser and Vancouver Coastal, that they were then again spread to across the province. Obviously, the Fraser or Vancouver Coastal numbers didn't go down; only increased with the move with those conditions, and obviously that seems to be playing out across the province now. What are the next steps in the provincial playbook that we could expect to see next week or further into the holiday season?
Yeah. What we have seen is a leveling off of cases in Fraser and Vancouver in particular. But what we have also seen is actually the increase has been primarily, if you look at it as doubling time of cases, where we're seeing the most rapid growth is in the north, the interior, and to a lesser extent here on the island. So those are all things that we're watching. We expanded the orders to cover the entire province because we started to see that movement around the province. And it's slightly different in different areas, what is driving the infections, but the main things that are driving transmission in all of BC is the social connections and social gatherings and interactions. So I've met again today with my colleagues, as I mentioned, to look at what are our options, what are the things that are working, where are we seeing transmission, what is the epidemiology that makes us look at focusing on other areas, what other areas are there to focus on. So we are still looking at those in some detail, and we'll be talking about them in detail on Monday.
Rob, do you have a follow-up?
Yes, I do. Just exactly as it relates to the doctor's point about transmission. Up here, we've had, we're into 10 months as everybody is in the world, but up here over the last week and a half, we've had two events, one in Fort St. John and one in Dawson concurrently that had over 100 people each, and this was some sort of rally against tyranny. You mentioned yourself, we've had some hockey players or hockey teams heading to Alberta, and we've got Canada Post people claiming that they've been to Alberta up here as well. At what point does the province stop using the word fatigue, and we're all fatigued, and start drilling down and using words like ignorance and getting not that there's going to be more stricter orders, but at least getting more front and center when it comes to, as other provinces have, speaking out against some people and some groups not following orders in any way, or in fact outright breaking them.
I know, and it's really difficult to see small groups of people, 100 and whatever. We saw some church groups on the weekend, but we have to remember that those are very small. If visible and vocal, they're not the majority of people in BC. And we need to focus on the fact that most of us are doing the right thing. And it is, I mean, how can I say it? I'm incredibly grateful, because that is what is going to make the difference. And yes, there are people who are floating the rules, and that's why we have orders that allow people to be fined, and we have implemented some of the measures that we've needed to take to close down places, to disperse gatherings. But I also believe that in a crisis like this, if we appeal to people's better natures, that comes out. If we give people the things that we need them to do and the means to do it, the most of us have shown time and again that we will do what we need to do to protect our families, to protect our communities. And it's a very small group of people that we often focus on that causes outrage. And it does. And it makes me upset when I see this sometimes, knowing how many people have died in our long-term care homes, knowing how hard our healthcare workers are working every single day, and how everybody is tired. It really makes you angry to see these small groups of people who are trying to make a point that is misguided. But we can't let ourselves take that in, because we need to support each other. We need to remember kindness and calmness, because that is what is going to get us through as a community until the other end. And the vast majority of people in BC are doing just that.
Next question is from Marcella Bernardo, News 1130.
Hi, Dr. Henry. I wanted to ask you, in keeping with what you just said, we're still hearing from parents who say it took up to 7 days to find out that their child may have been exposed at school. And you mentioned last week that there are efforts being made now to try to report that information in a more timely manner. Where are things at now in trying to get those exposure notices up as soon as possible?
Yeah, so our focus is obviously on making sure that the families and the school community is notified as soon as possible, and that those are posted. And there's been quite a lot of work with the school districts, with the Ministry of Education. My colleague, Dr. Reka Gustafson at BC CDC, is leading that with a team particularly focused in Fraser and Vancouver Coastal, where we know most of the schools and the transmission events are happening. But it is important across the province, and we are making progress in terms of catching up. Sometimes it's a challenge, because it may take time before somebody is tested, before we recognize that they're in a school situation. So it is not always possible, and now, because we give people text messages, and they may get their own results and share them with people before public health is even aware. But that's important. We now know how to manage these, and I know there's tools that are being developed and shared with principals, with schools, with families, so that if you do get that notification, you know what to do to keep your family safe, and to know what it means with an exposure event. The other thing that we're looking at, of course, is the data, and it's still, though we have quite a lot of exposure events where people have been in the school setting, there still is very rarely transmission in those settings. And if it is, it's mostly to one or most two other people. And we've had very few outbreaks, as you know, and we're trying to learn from all of those. So it takes time, but it is getting done, and I'm really impressed with the work that's been going on so far.
Do you have a follow-up, Marcella?
Yes, just regarding the, and this is what you actually talked about a few minutes ago, but the extremely loud voices who say they don't trust your science, and they keep accusing you of deliberately hiding data about what's really going on. What can you say now to try to calm those people down? Because I'm inundated with messages from people on Twitter and other social media who seem to think that you are avoiding questions and that you're trying to deliberately hide information. And you touched on it a bit about what the data is showing, but where is the data proving that transmission in schools is not happening or not happening frequently?
So can I suggest that maybe you don't follow Twitter quite so often? But, yes, it is important. And we have, from the very beginning, been open in this. And people send me all of this stuff as well about, people who are expounding at city council meetings here and there and letters about it all being a hoax. But you know what? This is very real. Ask any of the families who have lost a loved one how real this is. And we do share the information. As you know, we've presented the modeling in detail. We've presented the maps in detail. It's posted, and I would refer people to the BC CDC website on the dashboard. You can look at each region by age, by numbers per day, and then every week we put out a weekly surveillance summary that has age-related information, it has geographic information, and it has information that we've posted before on exposure settings as well. And yeah, it is a challenge, and part of the challenge that we've had is as we've had more and more cases, the amount of information that we can collect when we're talking to an individual. And just if we think about this, every single case that we investigate in public health takes several hours to go through with somebody, where they might have got it, what they're doing, what they need to do, who they had contact with. And this is a time when it's still very stressful for people. We know that people are worried when they get infected. Even young people are worried because we know that some young people will have have severe illness and end up in hospital. And thankfully, we've had very few deaths in young people, but that has not been the case in other parts of the country and the world. So when people are worried about their own health, they want to know what to do for their own symptoms, and they want to know about their family, it takes time to get that information. So we don't systematically collect all of the information that we'd like to, like information on ethnicity, and disaggregate it by race and income and all of those things. So we have to use other measures to get at some of that information. And we present that in the modeling, we present that in the data that we got from the survey and from other ways of trying to get understand the impact of both COVID and the measures that we're taking on people in BC. But all of the data that we have is available to people, and I'm not hiding anything. I'd like to give more as much as I can to people.
Next question is from Moira Witten, the Tyee.
Hi, good afternoon. Thank you so much for taking my question. My first one is, now that we're about a month since Seniors Advocate Isabel McKenzie released her report on the impacts of restricting visitors, among other measures, when can we expect to see decisions made either from you, Dr. Henry, or from the province on how current designated visitors can visit more often and perhaps in residents' rooms as well?
Yeah, so the challenge that we are facing right now is that this surge in our communities has dramatically increased the risk in long-term care. And so this is not a time where adding additional people into those risky environments is safe. So we're looking at how we can maintain and expand safely the visits that have been in place and the designated essential visitors, particularly making sure we have some consistency in essential visitors. But expanding to allow more social visits is not going to happen during this risky period of time right now. But we absolutely are looking at how we can make sure that essential visitors are able to visit safely and that those key visits that have been set up are able to happen. But when we have 57 outbreaks in care homes, there are no visits that are allowed during those. So the important thing of us reducing transmission, reducing risk, so that we can preserve the visits that are in place right now, that is our challenge.
Moira, do you have a follow-up? No?
Colleague, but given that students... Hello?
Go ahead.
Thank you. I'm just changing subjects for a colleague who has a question. But given that students can't, schools can't control who students interact with, how they interact outside of class, particularly for high school students who may be socializing independently without parental or guardian oversight, why aren't masks mandatory in schools right now, as we're seeing in other provinces with even more difficult pandemic situations right now?
So masking in schools is very much a part of the COVID safety plans in schools. And it is part of the safety plans from the very beginning. And we have, as you know, over and over again, reinforced that that is important, particularly in those areas where people are mixing, particularly for the adults in school situations, where the only place where masks, and if you look at the safety protocols in schools across the country, you'll see that we are aligned. It is when your child, especially young children, are sitting at their desks that masks are not required. And we've encouraged, of course, that young people learn how to wear a mask appropriately, that it's safe for them to do it, and we encourage parents and teachers and everybody to wear masks in those situations where they can't maintain distance with people outside their learning groups in their cohorts. But I mean, your question, if you think about it, you talked about people congregating outside places, and so the mask mandate that we put in place very recently talks about those public indoor places. And yes, children are required to wear masks in public indoor spaces as well as in their schools.
We have time for one more question today. For everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated information about the province's restrictions, visit gov.bc.ca/regional restrictions. And for information about the province's new orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question today is from Zara Premji, CBC.
Hi there. So Dr. Henry, this one's for you. Can you give us a bit more information about the team that traveled to Alberta? Where did they travel from? Was it a kids team? What is the age breakdown of the people associated with that team who are now infected with the virus?
I'm not going to give them away, but because I understand from what I'm hearing from my colleagues around the province, it's not unique. But I will say it was an adult old-timers hockey team that felt it was important to continue their travel and games across the border. And these are, that is unfortunately, for many adults, it's a very important part of their socialization, and that right now is risky. So those types of things cannot happen. And it meant that a number of the team came back and spread it to their family members in their workplaces and in their community. Nobody intended to do this, and I know that people feel like, oh, it'll be okay, we've not had any virus here, we'll be fine. But this is just another cautionary tale that right now you cannot take these types of license from the restrictions that we've put in place for all of our safety. So it cannot happen.
Zara, do you have a follow-up?
I do, thank you. So you did mention, obviously, that this spread into community as a result. So when you say it impacted the community, how far did it spread within the community as far as how many people tested positive or in isolation as a result? So we can get that bigger picture and understand this. And can we also get the response in French too, please?
So I don't have all of those numbers in front of me. I can tell you that there's been several instances that are similar to this, and we presented one from some data that involved a person who was infected in a group indoor fitness activity in Fraser Health, and how that had ramifications into their family, into a long-term care home, and that several hundred others were infected. Right now, we're only in the second and third chain of transmission from this one of these teams that I'm talking about, so I don't have the whole details of that, but I can tell you that it was several dozen families that were affected, several businesses that were affected, long-term care that was affected.
Oui, évidemment, cet incident démontre les risques de voyager un peu partout dans le pays, les risques de jouer ensemble dans certaines conditions. Et donc, c'était une équipe d'hockey sur glace adulte qui voyageait en Alberta. Et après son retour, il y avait des gens qui ont testé positif pour COVID-19. Il s'agit des douzaines de gens affectés par ce qui s'est passé. Et c'est pas notre intention de viser qui que ce soit, mais je pense qu'il est évident que les risques maintenant sont pas bien connus et compris par tout le monde. Et c'est pour cette raison-là qu'il faut suivre les conseils de Dr. Henry. Et je pense l'effet sur la communauté, des familles et des autres est important. Et maintenant, c'est le moment de garder contre des risques, de ne pas voyager sauf pour des raisons essentielles. Et cet incident démontre l'effet qu'on peut avoir. Je sais que des gens n'avaient pas cette intention, mais quand même, c'est eux et eux-mêmes et ses amis et ses familles et des autres dans la communauté qui paient les frais de cette décision. On parle souvent de prendre des risques pour soi-même, comme c'est une partie de la vie, et de temps en temps, c'est vrai. Mais pour prendre des tels risques pour des autres, ça, c'est pas acceptable, je pense. Merci beaucoup. Thank you very much. We'll see you tomorrow.